Welcome to Carib Nation Health. Today we're going to talk about the emergency use authorization of the COVID-19 vaccine in children 5 to 11 years old.
Yesterday's CDC Advisory Committee on Immunization Practices met to review the latest data from Pfizer on the safety and efficacy of COVID-19 vaccination in children 5 to 11. The committee also discussed in detail the clinical need for vaccination in these younger children. Throughout the day, I listened intently to the committee's open, transparent, and robust discussion. Following their unanimous vote, I endorse their strong recommendation that children 5 to 11 years old should be vaccinated with the Pfizer pediatric COVID-19 vaccine. With this vote, we are now expanding vaccine recommendations to more than 28 million children in the United States. I want to speak directly to parents about this recommendation. We have followed the scientific process. We have done our due diligence. Please know we have thoroughly reviewed all of the available safety, immunogenicity, and efficacy data before recommending this vaccine for your child. In clinical trials, vaccination was found to be nearly 91% effective in preventing COVID-19 among children ages 5 to 11. In clinical trials, vaccine side effects were mild, self-limiting, and similar to those seen in adults with other vaccines recommended for children. The most common side effect was a sore arm. The safety of our children is the of utmost importance to me, and I believe these vaccines will help us to better protect our children from COVID-19.
Hello, welcome to Carib Nation PD Health. I'm Dr. Goin Sindas, and we have
Dr. Kiana Nix.
Right, thank you. So today we are here to talk to you. We are both experienced general pediatricians. We care for children in all aspects in hospital, in the primary care setting, and overall we have really a lot to talk about today, because we are discussing COVID-19 vaccination approval by the FDA and CDC for children 5 to 11 years of age. We want to talk about it, give you our opinion, our experienced opinion. What do you think about it, Dr. Nix?
I definitely agree with the emergency use authorization of COVID-19 vaccine. As you can see during this pandemic, we're going somewhere, but we're not really out of the woods yet. And initially they were saying that kids were not transmitting the disease. And later on, we found out that kids also can be affected by the SARS-CoV-2 virus. And that they were saying also one time there were carriers. But, then we realized that MIS-C was occurring, which is the multi-inflammatory systemic syndrome in children, that led to the Kawasaki-like disease. And then kids were dying. Up to the last time I checked, we had 500 deaths. To some people, that may not be a significant amount, but one death, even one death is significant to us as pediatricians. So we all know that the vaccine is important to boost our immune system to fight the SARS-CoV-2 virus. So why not protect the kids as well? I mean, they're going back to school. They're struggling to wear their masks. I mean, it's not easy for the children to do that. So I would recommend it. Now, as pediatricians, we don't force people to do whatever in terms of, if you're hesitant about it, just talk to your child's pediatrician about it. So we're not saying, that you're not going to have questions. And no one wants, I don't want to force anything down your throats, but you know, we will talk about it, and hopefully you will understand the information that we're about to continue to give.
I totally agree, Dr. Nix. I totally agree because when COVID started, we had about 3% of children getting affected, and everyone was so happy. I mean, we were like, okay, in the frame of things, in the
Yes.
framework of how everything was, at least children were okay. Especially our children who wanted to go to college and high school and everything, our bigger kids ready to, jump into the world, they were okay. But we are up to 25% of cases of COVID are kids now. That's a big jump. And that's not something to play with, because if we keep just leave it alone, we're not going to bother with the kids. They have good immune systems. They're used to different types of coronaviruses. No, this one has significant repercussions. We are seeing young people with the long haul syndrome, which affects the neurologic syndrome. Now, the younger kids, when I say young people, I'm talking adolescents, which are your college students and beyond, or 18 and above. And then we're also seeing myocarditis due to COVID with the people 12 and above. And that's why they did push the vaccine initially to the teens, 16 and above for Pfizer and 12 and above. So now why should we wait? I really don't want us to wait. And then our little babies are going to be affected on a higher level. That is something nobody wants to see. We are so sorry, about our senior citizens being at such high risk, but we do not want to see little kids who didn't even have a chance to see life and grow and grow
Newborns,
this world, and newborns be affected. So we have to protect them. Now they have this super busy, energetic immune system. So that's why they're only going to give them half a dose. And that's why we are saying, with all the studies, it's a safe vaccine. Their immune systems are going to boost with it. We're not saying other things are not going to help boost their immune system, but for young people between 5 and 11 who just want to go to school and learn and play football and soccer and have a good life, we need to protect them. What do you think, Doc?
Yeah, I mean, the benefits definitely outweigh the risks. If you look at the bigger picture, we've been going through this since 2020. We've been going through this since 2020. And I don't see, I would like to see an end in sight.
Me too.
Yeah.
And look at the variants. The variants are there. So, okay, what are the variants? Some of them are more virulent than others. So there's the Delta, the Lambda. They're there. So they all have spike proteins, and that's why all the vaccines are geared toward giving you immunity to the surface of the actual virus, which are called spike proteins. And it does not go into the cell to destroy or disrupt your DNA. It is outside of the inner nucleus of each cell. It affects the cytoplasm, and it allows you to form proteins, and the proteins can tell your immune system, hi, I'm here, I'm here, I'm here, I'm here. Okay, whenever you see me next time, leave my body alone.
Yes.
It's not going to change you. It's not.
There's no microchip.
No microchip.
There's no microchip in this liquid.
Nope.
Not at all.
Nope. If they had discovered that, they wouldn't be using it on the vaccine. They'd be using it.
And we're both vaccinated. I'm not, saying that people who are not vaccinated don't have problems. We're not negating that. But, for the most part, the vaccination studies have shown that vaccination works. And not to forget, too, that even kids with previous COVID-19 infection, they are also recommended to get the vaccine. The vaccine is also recommended for them. So not because they've had previous infection, because the immune system really needs to be prepared for any future infection with the SARS-CoV-2 virus. And even if they get infected with the virus, the likelihood of them getting really sick is minimal.
Yeah.
Or they don't get as sick as, anyone without the vaccine. And that's the general.
That's the general. That is
indication.
true. In terms of the side effects from COVID, multi-inflammatory syndrome, and myocarditis. Many
Yes.
people are very scared about those two types of illnesses. Both of them can be scary. And actually, what is myocarditis? It is a very mild inflammation of the heart because it's just pain, flu-like symptoms, some swelling in the feet, and you really get palpitation. But in children, even adolescents, it is a mild, non-deadly, something you don't want to have. Okay, we definitely don't. Nobody wants to have it, but if you do, it is not deadly. And so again, that's when we're saying benefits of the vaccine outweigh the risk. And it's a very small amount of people are higher risk, more boys and more adolescent age group. Then the multi-system, Dr. Nix, talk about the multi-inflammatory.
Yeah, so the multi-inflammatory systemic syndrome in children, MISC, it presents like what you call a Kawasaki-like disease. You can get the fever, you can get inflammation of the tongue, swelling of the tongue. You can get peeling of the palms and the soles. And we're talking about the cardiac side effects. That's what we don't want, because it can lead to cardiac dysfunction, basically, or poor functioning of the heart, the heart muscle. So we definitely don't want that to happen in our kids. So that's why we would like to have the vaccines on board to prevent kids from getting infected with the virus, which will in effect affect the different the systems or affect your child. And with a more serious complication, which is the cardiac side effects.
The benefits of the vaccine outweigh the risk. Most children have a superior immune system that's very robust and will respond very fast to any vaccination. And this vaccination so far has a very good
efficacy. It's so funny because I recently read that the Pfizer vaccine, not that I'm promoting one over the other, I have no financial relationship with any pharmaceutical company anyway, but it had shown 90.7% efficacy in 5 to 11-year-olds. So that's the funny thing is I was just gonna say that.
Yes, that's very important. I mean, that's very high because honestly, our standard vaccines, most of them don't have that high level of efficacy, but they are very effective. So
they're all effective.
And they're all effective. So this is amazing. This is very good. Our children need this. One big factor that vaccination will help with is the mental health. A lot of people are having anxiety. They have their children in very isolated school, home, car, nowhere else. Not going to the kids. They don't take them outside. They don't let them go outside and play. Some parents really, the anxiety levels are high in our entire world. Stress, anxiety, depression, just because of the different levels of being isolated.
Yes. And imagine going back to school and you can't see your favorite teacher's face anymore. Your teacher is wearing a mask now. You can't interact with your favorite teacher like
some of them
used to. Yeah, the parents. Yeah, it's we're going through it right now, and really have to. We're here for our children, your children. to make sure that they remain mentally healthy and that, we continue to promote wellness. So we're living in, really unprecedented times, and we have to be here for you. We're here for you, and we will remain optimistic though. All is not lost. That's why we have to trust the scientists. I mean, we really are appreciative of the scientists out there, the physicians, the epidemiologists, the public health professionals. I mean, we're all working together to get through this. So, because we cannot continue like this. We cannot.
No, we can't, and we will still have to be vigilant.
Oh, yes.
Hand washing,
yes.
wear our masks.
Yes.
I know we're tired of hearing all of that, but it's just part of life for now, for a good while. Why not? Until we get, and each country has different vaccinations that their country has. I mean, look, they're all, so if they are approved, they are good to use. Read, be informed, go to your doctor, ask good questions. Don't go on YouTube and look for things. Go and ask the professionals. If you don't want to go, get a televideo visit, give a call to your head nurse in your immunization program, your local health department, and then ask all your questions. Please trust your local health department based on the vaccinations that are available to you. They are not going to try to cause any harm on the population. Between your public health, your government, and your epidemiologists, the vaccine chosen for your region is based on the population, and the cost mattered as well. That doesn't mean that the vaccines are any less effective. Some of them have different efficacies, but definitely, more than likely, it's more important for you to read than ask questions specifically to your personal doctor or provider, and in your region where you live. That's the most important. Do not subscribe to what people are telling you here and there.
You get confused.
Yeah, you get confused. Talk to professionals.
Yes, you get confused. And going back to what you said earlier about continuing to wear your mask and washing your hands, do you know that parents do appreciate the mask wearing? I have met so many parents who are happy that we're wearing masks, because they are saying that kids, they can say, okay, well, usually this time of the year, they would have gotten sick, have colds like 3 or 4 times, and
the
it's
allergies,
only maybe one time. No allergy. Yes, so they appreciate that, and the hand washing. They also appreciate that too. So kids are actually aware of self-hygiene now, which is also a great thing.
There's
So
definite COVID benefits.
Yes, good things have come out of this. Yeah, here even the little babies, everybody.
Everybody knows that use their sanitizer before they go play on the jungle gym, and wash their hands right immediately after. So it's really good. We have reinforced some things we always need to do anyway.
Yes, but also remember, when you wash your hands, like, well, us in the healthcare field, when we wash our hands, it gets really dry. So I've had parents, complaining about, the dryness of the hands. So yes, get them after you wash your hands. You can get your preferred moisturizing lotion. I remember, though, I have to talk about this, seeing parent complaining that maybe, the changing of the nails for the hand sanitizer. So you have to know what product, make sure that you're not allergic to, that whatever they're using, that component. But that's not very common at all. One of the side effects, pain at the side and soreness at the side, and flu, like you feel like you're getting sick for a day or two. That is your immune system telling you that, hey, I'm getting ready to fight. My soldiers are getting ready. We're getting primed, like your immune system is getting primed up and ready for the fight.
And then some people have allergy to the content and have a risk for anaphylaxis.
Yes.
So still, even with the children, we have to monitor them for anaphylaxis, which is severe allergic reaction. And so after the vaccine, if they have those risks in there, they should have their appropriate medications on hand, or their doctor will have it for them.
Yes,
they will be monitored for 15 to 30 minutes.
Yes.
About 30 minutes most of the time. And as long as everything is okay, then they'll go home. And
I would prefer to observe for as long the maximum time, like 30 minutes at least. That's my preference.
45. I have allergies.
Yeah, that too. I mean,
I wasn't going home.
And we can individualize our patients. You know, if you know a patient has sensitivities, I would wait for as long as possible.
Yeah.
You know, so yeah. Because anywhere you go to get your vaccine, they are supposed to have emergency equipment, emergency medications on hand. So make sure that happens when you go get your shots.
So let's talk about the high-risk children who are high risk for COVID, and that really should have their antennas up and be very vigilant. And so those are patients who have asthma, any kind of chronic lung, obesity, and maybe your doctor doesn't always tell you, oh, you're obese, because we don't like to use that's kind of a bad word, and we feel it can be psychologically damning.
Yes.
But your doctor will, if your doctor has told you that you need to reduce, then you're probably in the high risk area, okay? And they're like patients with chronic lung disease, renal failure, preemies, preemies, anyone who was ever on a ventilator as a child, after birth, when the ICU had a chronic lung or extreme preemies.
People with immunocompromised diseases, type of diseases, immune.
So there's a lot of children with these issues. Even developmental delay is considered a increased risk for COVID or immunocompromised slightly. And we just wanted you to be protecting your child, because those factors affect their long-term development. And the more they thrive, stay away from infections that affect their lungs and their development, the better. And that's another reason to be very vigilant, but also keep informed and speak to your doctor. Keep your risk low for any loss.
Yes, we are here in the business to save lives. That's what we do. We're here to save lives.
It's a blessing. It's a blessing. It's a blessing. We are very thankful to have that opportunity to be there with our families, right, Dr. Nix?
Yes. Yeah. We are very grateful. Extremely, really grateful. We take nothing, absolutely nothing for granted. And we are grateful for our patients as well. We're happy when we see them, because we don't take you for granted either. We're not.
You get the most hugs, so yeah, I love them. Hugs are all that. So
yeah, but not in these days.
No, I can't hug. I know this.
Yeah, but they still come and hug you though. The kids still come and hold on to your
with the mask on, hugging you.
Yeah. The parent, I mean, that's what kids do. They're it's normal. Yeah.
Okay. Well, I guess we can end on that note. Because
the other day I saw a kid and he walked and he said, I'm so happy to see you.
Yeah.
Oh.
So it's fun. You get to be another auntie and auntie doctor. And hugs. And we love it. And we hope we have given you some good information. We hope we've shared the love that we are very much here for you. Thank you for joining us on Carib Nation TV Health today. We thoroughly enjoyed this conversation. We hope it was very informative. Please look us up at trustedmedicalmd.com We have our own practice, the Pediatric and Holistic Wellness, and we'd love to see you. Come by and check us out. We're on Instagram at TrustedMD and Trusted Medical Services on Facebook. Please check us out, like and share. Please share this video. Please give us some comments. Tell us what you would like to see in the future in terms of shows on the health realm. We love to hear from you. So please, thank you. We really enjoyed this time today.
Thank you for joining us at Caribbean TV Health. And remember, we're one people, one culture,
one Caribbean, and one nation. Thank you for joining us. Bye.
Bye.